making sure my patient is okay. I want to do what with my patient though? He's having some, so he's having some difficulty. I want to let his head up. Okay, he has his oxygen, and when the oxygen is on, guys, it's bubbling. Okay, so this, I don't know if they have it on right. Sounds like it's not on correctly, but it will bubble. Okay, this is their humidification. Okay, so I'll turn it off for now because it seems like there's something wrong with it. Okay, so you want to let their head up a little bit more. Okay, kind of get them in like a semi-fowler's position if they can tolerate it. So you know you're gonna need your what, ambu bag. Okay, you're gonna not hook this up until you're ready to suction. Okay, you're gonna hook it up to here. You're gonna take this off and hook them up to here. You're not gonna hook it up to there. Okay, usually you don't have this one in the hospital. This is just for us so we can get oxygen. Okay, so you take your other one. If someone can give me a bedside table, just from right over there. Okay, your other one needs to have, remember guys, you have all of these little ports here. So one needs to say the patient. It'll tell you on here, it says patient. So you know you need to put this one for the patient. And I'm gonna leave this on the bed as well because I'm gonna be hooking up my catheter, my suction catheter to it. Okay? I can also get me a, what?
Chuck.
A chuck to go across their chest, right? Okay. I get me just a regular pair of gloves for now. Because sometimes you don't want to just touch all this stuff with your bare hands. You put the chuck there with your bare hands. Okay? So I know that I'm going to need to suction him, and then afterwards I'm going to do his trach care. Okay? So usually this thing has a little snap on it. You can snap it off and you can keep it right on the side. Okay, but in this case it doesn't have one, so I'm going to have to bring it over his head and kind of leave it here. Okay, you can do that. Okay? The next thing I want to do is I want to take this dirty gauze out. And you want to look and see what's on there. See what it's draining with. Okay? So the next thing I'm going to bring in all of my material. Make sure your saline is what? You. So if you're bringing in your saline,
24 hours.
yes. So if it's been open, you want to make sure there's a date and a time that it was opened. Okay? So don't leave these. There. Okay? So I've already got a chug for him. So that's cool. All right? Now I have my kit. Make sure that it hasn't been tampered with. Make sure that the expiration date is good. And now we're good to go. Okay? I go ahead and open my saline. And we're going to go ahead and lip it. Okay, you can do that before you get started. Okay, so remember, we're going to open up our kit, what, away from you, right? Wow, they really tried to tape this back to me. We're going to pretend that's okay. All right, so got it open. And what's the first thing we see? I like to do this. The first thing we see is our gloves. Okay, I'm going to go ahead and put my gloves on. I'm going to use this as my sterile field. So I want to make sure I don't contaminate it. Okay, so I'll go ahead and open. Okay. Remember that 1-inch border though is not sterile. Only on the inside. Okay, so I'll go ahead and take my gloves. Learn how to work with one hand. One hand is going to be sterile. One hand is not going to be so sterile. Okay? The next thing I like to do is I like to take my catheter kit out. Okay? Just put that there. And I want to put my saline in my cup. Okay? So I'm going to take the one that's going to be non-sterile. And I am going to pour. We actually are not going to be using any saline. Okay? All right, now I got to set up all my stuff, right? So I can turn on my, and this should be between 120 and 150. Okay? So I got it at 120. You can adjust it however you want. Okay? So now I know that I am going to set this up after I put on mine. So I'm looking at my pulse ox. He's still at 89. Nothing has changed. Okay, so I'm going to change this. Okay, just can kind of wrap this around on the bed. And if it falls to the floor, guys, just make sure you get something to wipe it off. Okay, so I'm going to go ahead and give my patient a couple of breaths because he's at 89. Okay. All right. 1, 2. Okay. And then you just gotta have to flip it off. Just make sure you hold and adjust his trach. Okay. So now the next thing I'm going to do is I am going to hook my catheter up. Okay. So when you take your catheter, you make sure that your catheter tip does not flop all over. Because remember, that's sterile. Okay. Now I'm going to test to make sure that my suction is good enough. Okay. So I just kind of make sure it has a good suction. And usually you'll hear it. Okay. It looks like it kind of dropped a little bit. So if you want to, you could go ahead and adjust it up. I don't know how good these things work. They probably don't work very good.
The tube's not connected.
Yeah. Oh, my tube. Good catch. Good catch. That's probably why it wouldn't work. Where did it go?
It's hanging on the lip.
Oh, so good thing. So now you have to find it. Oh, there we go. You're probably going to get some suction now. And I had it up too high. I had
In the video, it said 100 to 120.
Yeah. But your book says 120 to 150. Okay? So make sure you go by your book. So now I can test. Okay? All right. So now I'm ready to suction. Okay? So when I'm getting ready to suction, you guys got to make sure that this does not touch anything and your sterile glove. Okay? So as I go in, it says I'm going to go in about what? So, you know what? Sometimes you can't go by that. You got to go by when you meet resistance or the patient starts to cough. Okay, so the patient starts to cough. I'm going to circle. And how many seconds I have to come out?
Maximum of 10.
Okay, so I'm going to go do this. And wrap this back around.
And do you wait between the passes?
Wait for what?
Aren't you supposed to wait a minute between each pass?
No. You're not going to wait a minute.
Okay.
Because remember, that patient's pulse ox is 89. Okay, so I give him the 2 breaths. Okay, I'm looking at my pulse ox. It still just went up one notch. Only went up 90. So now I'm ready to do it again. Sorry, guys. Okay. And you can also wear your PPE, whatever PPE you want to wear. Okay. So you're going to go down. Usually you're wearing a mask and a gown. Okay, he's starting to cough. Okay. Circle motion. Come out. Oh, look at there. The pulse ox went up to 93. Okay. But I think I want to go down one more time. I can go down how many times? 3. 3. Okay. Okay. Anytime someone's, you're not going to wait that full minute. Can you imagine just waiting? Okay. So now I'm going to go down again. And sometimes you got to kind of feed it in. Okay. So he's coughing, and I'm not getting as much. So as you're coming out, you're doing a little circle, and your hand is going on and up. You're not going to just leave it there, because what will happen if you leave it there?
You could pull other things.
You're taking out their oxygen, okay? Oh boy, he looks much, much better, right? Okay, so the first thing I can do is I can turn this off, okay? And I want to make sure that I go ahead and put on his oxygen, okay? So now he's at 95. That's pretty good, right? That's much better than what it was. It was 80, was it what? 89, okay? So you always want to make sure that you chart how many times you suctioned and what the oxygen level was, O2 sat was, and what it is now, okay? So now I don't have to really rush, you know, because I can leave the pulse ox on while I do his tracheostomy care, okay? So just get all this stuff out your way, okay? And leave it up here for now. When you're done, you can put it back in the little bag. Okay, I can leave this here if it's clean. If it's dirty, you know, you gotta take, you can get rid of all this, right? And you won't be doing that, guys. Don't be putting okay. So I'm gonna leave my saline there, but I'm gonna put the top on. And I'm gonna get rid of all of this stuff. I'm gonna change my gloves, right? And I'm gonna do hand hygiene. Okay, so he's at 95. Oh, I just need to